So let's break down the interesting things about the Artiste Lift on this beautiful 57-year-old patient of ours. She came in and wanted to look like herself, look natural, but look better. But again, very pretty face. She has a long, lean neck, but she's getting the platysmal bands that are popping up. She has jowls that are forming. She has a very interesting cyst on the side of her neck there. She has fat pads that have fallen down to above the nasolabial folds here. So she has descent in her cheeks, in her jowls, and in her neck. And therefore, she's a great candidate for a facelift. So what do? We did our base Artiste Lift, right? Which is a deep plane face and neck lift with a preservation technique. And we also did an upper lid blepharoplasty on her. And then we did fat transfer through the areas of her folds, her marionettes, her pre-jowl. And then to take away the excess bunching skin, we did a little temple lift to smooth out the skin. And you can see the result is a beautiful natural result, right? Natural is the trend. That's all I've ever known for 20 years of being a facial plastic surgeon. Our patients always know they're going to look like themselves. They're going to look natural. But let's break down some of the interesting things. So her hyoid bone, which is right here, that is sagging a little bit on her in her before photo. And during surgery, you noticed it had very tight attachments. And I see this sometimes where the hyoid bone is very attached, and that means it's going to be harder to lift it up. The good news is we know how to do this. We know how to release that hyoid with a hyoid fasciotomy. We know how to take away some of the excess tissues there that are holding it down. So that when we lift the neck, we're not just lifting back like this, we're lifting truly vertically. And you can see in her after her hyoid bone has gone up and she has a longer, sharper neckline. We also very interestingly took the sebaceous cyst out of her neck. And so that part's gone for good. You can see how her jawline is sharp now. It wasn't terrible to start, but now it just looks very natural and sharp and beautiful. We've put in a little bit of fat in her marionette lines, and that has softened the jowl as well, especially when we put fat in that pre-jowl area. The temporal lift, again, is not something that's changing her brows significantly, but it's helping smooth out the skin. So it's a silent partner in making sure everything looks harmonious and balanced. Her upper blepharoplasty, she has very distinctive eyes, right? We don't want to hollow them out and create eyes that are too big. So we've taken the right amount of skin to open them up a little bit. The end result is a beautiful, natural result. You can see her photos here as she progressed. The bruising was minimal, and we're very happy with the result.